Well, I think I should put that into larger context. You know, the Surgeon General of the U.S. has recommended that all of us get about 300 minutes of physical activity every week, so that's about an hour on most days of the week. That's probably the hardest habit for adults to develop, and it also is increasingly a very hard habit for children to develop. The reality is that for people with diabetes, whether they have type 1 or type 2 diabetes, the less body fat they have and the more muscle that they have, the easier it is to take care of their diabetes. So we really do encourage you to take your child and to expose them to a wide variety of physical activities. And you know, there's some kids that don't like sports, and that's okay. There are lots of other ways to get physical activity. For example, in South Texas, many of our families like dancing, for example, and there are a type of dancing called folklorico that gets very, very physically active. Right now, among my patients, among moms and daughters especially, Zumba is very popular. And so I always encourage families to you know, expose their child to a wide variety of physical activities, but also encourage them to sort of focus on trying to get, as a family, not just the child, but as a family, to try to average about an hour of planned physical activity every day. Now, fortunately, children, at least in elementary school, often have about 30 minutes of physical activity most school days that's organized, which means that for busy families like yours, maybe 30 minutes outside of school with your child is a good idea. On the other hand, as an adult, we should also be striving to get sort of an hour of physical activity most days. And I think as parents, we all have a responsibility to model for our children good behaviors. And physical activity is actually a really good behavior for long-term health for you as well as your child.